Thank you for coming today, and would you state your full name and date of birth?
My name is John Butler Mulliken. I was born 4/30/38.
Would you tell us what your parents' names were?
My father's name was John Raymond Mulliken. He was a regional sales manager for General Mills in the flour division. My mother's name's Mary Jane Seifert, and she was fascinated by publicity and worked with the Minnesota Women's Golf Association. Her father was an oral surgeon, and I often think that that talent is in my bloodline. I was actually born in Chicago, but I grew up in Minneapolis in a little suburb called Edina outside of Minneapolis. I went to Edina High School and then went on to Princeton University, Columbia University College of Physicians and Surgeons. I did my residency at Massachusetts General Hospital for 5 years, 1 year in the laboratory. And I went in the Army for 2 years in Korea, in the last MASH hospital, and came back, went to Johns Hopkins for my residency in plastic surgery. And then in 1974, I joined Dr. Joseph Murray in Boston.
Tell me a little bit about what inspired you to go into plastic surgery and your mentors.
I can remember as a first-year resident, we had an internship in those days, and so the next year was called first-year residency. And I was on the plastic surgical service and met Dr. Bradford Cannon and Dr. John Constable, and I just knew right away that I wanted to be like them. I was fascinated by the problems, and as a first-year resident, I actually did 1 or 2 cleft lip repairs and a cleft palate repair. And in those days in general surgery, David, as you know, it was a general surgery in a true sense, so we were rotated through different specialties. And I did a reduction mammoplasty during my residency. I would do maxillectomy and things that were considered plastic surgery. There was no division at plastic surgery at Mass General at that time. 3 mentors that I always list. First is Dr. Judah Folkman. Dr. Joe Folkman is the father of angiogenesis. He was my chief resident at MGH, and I worked with him for the next 30, 40 years. He's a preeminent surgeon scientist, and he taught me how to ask questions of Mother Nature and how to wring her neck and try to get some answers. My next well-known mentor is Dr. Paul Tessier, father of craniofacial surgery. He taught me how to conceive of operations and the importance of doing a full dissection before doing the procedure. My major mentor, of course, Dr. Joseph Murray, father of solid organ transplantation, 1990 Nobel laureate. Dr. Murray taught me how to think logically about problems, how to think logically about an operation, how to speak logically and in a credible fashion. He also taught me how to prioritize what's important in life. I got even closer to Dr. Murray after he retired in 1986. I used to come out to his house every month or so, and we'd always have my colleagues, Dr. Joe Upton and Dr. Lenny Cabin, the oral surgeon. We'd always have dinner with Dr. Murray about the time of his birthday on April 1st. I miss him greatly. When I started with Dr. Murray, he sent me a letter, which I still have, and said, you ought to do something in academic life. What's going to be your topic? What's going to be your focus? And he said, I suggest either skin cancers or hemangiomas. Well, I knew I was going to get a skin cancer, and I was obviously more fascinated by hemangiomas. I'd seen a few as a resident. And I started taking care of these little kids with vascular birthmarks in the clinic, and I quickly realized that the words in the textbooks did not correspond to what I was seeing in the clinic. That is to say, when I tried to figure out how to take care of them, they had nothing to do with what I was seeing in the children compared to what I read in the textbooks. Everything was called hemangioma, everything that was pink, red, or blue. And so I said, there's something going on here. I've got to figure out what it is. And I enlisted the help of my friend Julie Glowacki, a PhD who I had worked with in the laboratory at MGH. And she was working in Dr. Judah Folkman's laboratory at that time. Judah was my mentor and offered to let me come to his laboratory and work. And so I started to take specimens of vascular anomalies whenever I would take them off. And I'd take them over to Julie, and we'd stain them in various ways, and start going over the slides on Saturdays. And one day I remember I asked Dr. Folkman, what's the best way to look at this problem? And he said, you should find out what cell is upregulated. That was the key question to ask of Mother Nature. And we found out there were really, Mother Nature had two major categories of vascular anomalies. Tumors, in which the cells are upregulated, and vascular malformations, in which the cells were quiescent, at least for a time. Julie Glowacki and I wrote a paper in 1982 on this differentiation between tumors and malformations in vascular anomalies. And I'm proud to say, I believe that paper is still the most quoted paper in plastic surgical paper in the literature. People ask me about vascular anomalies. I think there are only one or two people in the United States, plastic surgeons, that are interested, purport to be interested in vascular anomalies. I'm certainly one of them. I believe it's to be interested in vascular anomalies, David, you have to have a germline mutation. You're born with it. You're born with a genetic predisposition to thrive on confusion, uncertainty, and to love esoterica and enjoy a good mystery. But many plastic surgeons, they just want to know what the operation is and what to do and get on with it. But I've had great time in this, what I call a fertile field of vascular anomalies. We started an international society back in '76, Dr. Tony Young and I. And I'm proud to say the second edition of our textbook on vascular anomalies just was published by Oxford University Press in 2013. The next area of major interest, for some reason I've been always interested in molecular genetics, although I didn't do particularly well in medical school, don't remember it. I don't think we knew very much about molecular genetics in medical school. But I realized that we had families I had seen families with vascular anomalies that seemed to track in an autosomal dominant fashion. And I was so privileged to have two young surgeons, two young physicians come to work with me as fellows, Dr. Lawrence Boone from Brussels and Dr. Mika Vikula, who was from Finland at the time. And the two of them met for the first time in my office to discuss these families with vascular anomalies. And they looked at one another, and before I knew it, they were living together, and before I knew it, they were married. And the two of them have the most remarkable laboratory on looking at genetics and vascular anomalies in Brussels. He subsequently moved from Finland and learned how to speak French and is Brussels. I'm the godfather to their child. I'll never forget the night they called me. In order to try to find out what was causing these vascular anomalies, we would go out at night and draw blood samples. And I had the tubes in my back of my car, and we didn't have IRB in those days. We didn't have to have IRB. And I'd carry these tubes and syringes and take pictures of the families. We get all the families together on Thanksgivings and holidays and so forth. And we're drawing these blood samples, and Mika and Lawrence would take the samples to the laboratory in Bjorn Olsen's laboratory at Harvard and started looking for the genes. And this went on for, I don't know, maybe a year or so. And one night they called me about 11 o'clock and said, I think we found the gene by linkage analysis. And I was so excited. Let's go out. And it was 11 o'clock. I'll never forget. It was one of the most exciting times in my life. I jumped in my old Alpha, opened the rooftop and put on a country western song. We ran off to a bar and had a great time that night. I've written about this in a paper called The Sense of Wonder, which was published in 2002. I'll give you a copy of it. Okay. And that is, as a surgeon, people say, it must be great to be a surgeon, take care of kids, and do these wonderful operations. And it is great fun. I love operating. I'm still operating. But there's something about finding an answer, getting an answer from Mother Nature that no one else had ever known about, that's even a higher level of excitement. And that's the feeling I get in the operating room when I get a blood sample or a tissue sample and send it to the laboratory to put the sample into a mouse or into culture and come up with an answer. So I think that's, for me, has been part of being an academic surgeon, is to make use of the tissues and try to find answers to questions. I never forget when Dr. Millard came to Boston as visiting professor in 1977 as the Monk's Lecture, and he gave a talk on bilateral cleft lip. It was a great talk, 1 hour long, and he looked at the slides at the end of his talk and he said, "We really must do better." And that really hit me. It became my clarion call. I said, we've got to do better, because the results with bilateral cleft lip were awful, and they're still not as good as they should be. Presented my first paper in 1985 at the association on the principles that I had induced from the literature and from the clinic on how to repair bilateral cleft lip and nasal deformity at the same time. So the repair of bilateral cleft lip and primary nasal correction I consider to be one of my major contributions.
You think we lack that in our education now for residents coming out? That part of it?
Cleft lip repair?
Yes.
Good question. David, you just tapped into a subject you and I could talk about for a long time. I am a little unhappy or disturbed that the residents nowadays, as bright as they are, and they're much brighter than I am, and ever will be, but the training is such that they're not technically anywhere near what it was when you trained fully in general surgery. And I could go on, and I can't help residents do cleft lip and palate. They're just not trained well enough, and we can't do it in the climate of the insurance and medical legal issues. But I do have fellows with me all the time, and I can say that my fellows that have trained with me all do really great cleft lip and palate work. I've gone to a lot of meetings in my life. Many of them are forgettable, but I think what I have learned in going to meetings is who's credible and who's not, and listening to presentations. But every now and then there's 1 or 2 meetings that really stand out, and one that I'll never forget was a pre-symposium for the American Cleft Palate Association held in Hilton Head in 2001, and I showed my presentation on bilateral cleft lip and palate, the usual before and after pictures that plastic surgeons love to show. I was very proud. I thought they looked really good. And I went down to the floor afterwards, and people gathered around and had questions for me. And there was a well-dressed gentleman standing there, and after everybody left, he came up to me in a quiet voice and said, "Those are great photographs, but why don't you measure them?" And that was Dr. Leslie Farkas, the father of medical anthropometry. And he introduced me to the world of anthropometry, and that changed my life professionally, because I started measuring cleft lips and palates and craniofacial anomalies. And I think that trying to understand these conditions after growth and procedures in the fourth dimension is a major conceptual advance for me, at least. My greatest joy is playing with my daughter Olivia, who's now almost 5 years of age. And whenever I look at her, everything I've written seems to shrink into insignificance. I didn't get married till I was 70 years. I don't advise that to young plastic surgeons. My wife, Dr. Portia Chu, who's also a plastic surgeon, and I married at St. Patrick's Cathedral in New York. Dr. Joseph McCarthy was one of my groomsmen. I was paying him back because I was his groomsman when he got married in 1964. As I hope is obvious, I'm still really excited about being a plastic surgeon, a pediatric plastic surgeon. I still get up early. I try to work late, but I tend to fall asleep more than I used to. I love what I'm doing. I'm still taking notes every day. I'm working on a book. And of course, my little child helps me keep going. My piece of advice is find your earthworm. That's in my paper, The Sense of Wonder. But what it really means is find out what you're good at. Find out what your talent is. Make sure you're doing what you were put on God's green earth to do. And as you look back on your education, what subject came easiest to you? What did you like doing? What did you stay up late trying to learn more about? What did you go to the library and you didn't fall asleep? That's what you should be doing, and everybody's trying to find that. Joseph Campbell, the American mythologist, put it best when he said, "You've got to find your bliss." There's more to be learned at the interface between specialties than within plastic surgery. Try to collaborate with other specialists who are in other fields and think differently than you do. Last piece of advice, take your wife out for a dinner date at least once a week. My dream, if I had to retire, would be, I hoped I had done something to make the world better in terms of the problems that we deal with plastic surgeons. I really would like to say that I've done something to prevent the problems that I've dealt with. That would be the greatest joy, to prevent hemangiomas, to give every newborn a drug or a salve or something that prevent them from getting a vascular hemangioma. I'm not sure I can prevent vascular malformations, but if we understand the genetics, we can deal with them better. I send blood studies off on all my cleft lips and palates that I can. I've been working with molecular geneticists in Texas for about 15 years, trying to find the genes that cause cleft lip and palate. And they're gradually tracking them. They've got 4 or 5 genes that are of major interest. And so wouldn't it be wonderful if we could prevent cleft lip and palate? As a surgeon, I'll have to put myself out of business. Then I could comfortably retire.